All right, thank you, Rachel. October is Breast Cancer Awareness Month, and it is important for our mothers, our wives, and our sisters to protect themselves and get a mammogram. Joining us now to tell us more about the importance of breast cancer awareness and prevention is Lisa Vaughn, a mammography technologist from the Mammography Radiology Department at UNM Sandoval Regional Medical Center. Lisa, thanks for coming in. We can't talk about this subject enough.
Right.
So, first question here, and Rachel and I were actually talking about this yesterday because I've heard different numbers. What is the age that women should start getting a mammogram?
Women should start getting mammograms at the age of 40,
40.
unless they're high risk. If they're high risk, they should consult their physician and see what the age is appropriate.
So then that begs the next question. What makes someone high risk?
There's several factors that make somebody high risk, one of which is having multiple first-degree relatives that are diagnosed with breast cancer.
Okay.
Another thing is testing positive for the BRCA1 or BRCA2 gene mutation,
Okay.
or having a relative who's tested positive for that.
Okay. Now, is that, correct me if I'm wrong, that's, and I just bring this up because of, celebrity, obviously this brings to light. Now, was that the same gene mutation that Angelina Jolie discovered, which prompted her to have a mastectomy? Is that correct?
It is.
Okay, okay, so getting that done. Now, another question that I have also is there an age that women should stop doing it, or is this something that once you hit a certain age, it just becomes a lifelong thing?
It is a lifelong thing. I think the only reason that you should stop having mammograms is if you get to a point where, due to health problems, that you would be unable to undergo treatment for breast cancer.
Okay, and so one thing that I think is interesting about Sandoval Regional Medical Center, obviously technology continues to grow and it helps medicine detect things earlier. You guys are one of the first places to have 3D breast imaging.
Yes,
is that right?
That is correct.
So first question, what is the difference between 2D and 3D, and how is it helping find the disease earlier and helping people recover quicker?
Okay, well there's several differences between 2D and 3D. One main one is the fact that with two-dimensional mammography, you're only taking 2 images of each breast with 2 different angles. Mm-hmm. With three-dimensional mammography, you are actually taking multiple images in different angles, as well as getting the 2-dimensional images. Another difference would be the amount of time you're getting compression. People think that because it's 3D, it's the newest technology, there is no compression, but actually it's a little bit longer.
Okay.
So with 2D, you're only getting about 4 to 5 seconds that you're in the machine, where with 3D, you're getting about 10 seconds.
Okay.
And there is more radiation with three-dimensional, but it's well within the guidelines of the American College of Radiology.
Okay.
So it's about the same amount as you would get from taking 2 transcontinental airline flights.
Oh, no
kidding. Yeah.
Okay, okay.
Yeah.
So the radiation's still quite low considering the risks that,
Correct.
and if it happens. Now, obviously these great treatments are great detections, but we want to detect it at home doing self-exams.
Of course.
What are the guidelines for women at home that want to do a self-exam, and how often should they do one?
They should be doing self-exams monthly.
Monthly.
Yeah,
Okay.
so, and if some people don't feel comfortable, I have patients that say they don't know the differences in the changes of breast tissue. So you can go to your annual and have your doctor do it as well.
Okay.
They should be able to perform that.
Okay, and so getting in touch with our doctor, if we want to talk to someone at the Sandoval Regional Medical Center,
Yes.
what is the best way to contact you?
To schedule a mammogram, you don't need a referral for a screening mammogram.
Oh, that's great. That's good
Yeah,
to know.
so you can just call our number. It's 994-7200, and
Okay.
it's the area code 505.
Okay.
So yeah, so we don't need you to go to see a doctor to get a screening
Okay,
referral.
that's fantastic. You can just call directly and get that set up. Well, guys, if you want more information about this, you want to schedule a mammogram, or just get more information in general, head over to casa.com. We'll have all the links to the Sandoval Regional Medical Center. Lisa, thank you so much.